Hello, I will try to explain one of my cases using personal evolution module. Let's begin. It's a case of a male patient, 37 years old. He has lot of urinary complaints since past 5 to 6 years. Frequent painful incomplete emptying of urine. He says flow of urine is drop by drop. Poor flow, has to strain for urination. No stream and only small quantity. He says I get frequent urge for urination every 15-20 minutes. Severe pain during the urge. Also dull heavy pain all day. Burning during urination is on and off. At night I have to wake up 10 to 12 times for urination. Pain is continuous as if sticks thorns inside. He has taken many treatments. Even he has tried many therapies but of no effect. He underwent surgery for the same at Hinduja Hospital, Mumbai. During surgery, after giving anesthesia, the urologist said that there is no stricture or issue with urethra, just swelling of prostate. So the surgery was not helpful. Any other complaint? I asked. He said he had heel pain and numbness of foot. He also gets lower back pain on standing. 10 मिनट से ज़्यादा खड़ा रहता हूँ तो lower back pain करता है. So I asked him, do you have any other stress? And he's like, lot of stress of family and business. In 2012, we faced financial loss. There was robbery at our jewelry shop. He was sad and nervous then, had diarrhea episodes and weight loss. But I didn't give up, tried hard to rise again. In 2016, my father expired. He was suffering from liver cirrhosis. It was a big shock. I, being the elder son, had to take up all the responsibilities. So he says, ours is a big joint family with 3 brothers. Once I get them married and hand over them business share, then I will be free and relax. In the past, we used to travel with lot of gold to different places for sale. Lot of cash, lot of stock, lot of tension along. Can't get down from bus for meals or nature's call. They had to control the urge till they reached a safe place. Also during lockdown, he was worried about his business. Again, there were some financial losses, but I could manage it all. Describe your nature. I am reserved and silent. I will not share. I get angry and irritable when things are not my way. I can't tolerate contradictions. Can't take a joke. I love meeting people. He's social. He does charity and he's a part of organizations like Rotary. I have lot of expectations from my brother. My younger brother is slow. He will not finalize or take decisions. I get angry then. I am fast. I don't have patience. I will make him rush. I am easily hurt but will not reflect. Upset with wife. She blames me. I take big decisions on my own. I have 3 daughters, but it's okay. New office is under construction. I come up with new ideas and techniques. I can't tolerate hunger, empty feeling in the stomach. He has craving for spices and whiskey sometimes, aversion to sweets, his sleep is disturbed. He has dreams of daily routine of shop and he has to hurry to reach his destination. Even he flies to reach on time. There is thirst. Sweat is mild. Urine is yellow and offensive. He has no habit. He loves to listen to music and religious songs. So my analysis is he's a sensitive person. He gets upset and hurt easily. He's impatient, he's hurried, he talks of business, lot of responsibilities, he's social, he's confident, he has sleep issues. So we come to, okay, first I'll tell you his reports. He has some residual urine cystitis, but uh, urine report shows no infection. On ascending urethrogram was done which showed smooth narrowing in proximal urethra. This is the narrowing which is seen. This is the narrowing which is seen. I trying to show it with pointer. Yes, this is the narrowing, and this is his discharge report of Hinduja Hospital, which was surgery was cancelled because they told there is no stricture or obstruction, but uroflowmetry shows obstruction, USG shows cystitis, and ascending urethrogram shows narrowing of proximal urethra. So they gave him Alfu 10 mg for 1 month, but he had no relief. The remedy was selected from the plant kingdom dicot chart. Why dicot chart? Because he is a very developed person, he is very responsible, duty conscious, and he is thinking about his family. And the remedy belongs to the sixth subclass Asterids I and the group order Gentianals, family Loganiaceae, anal stage of development. Sixth subclass because he is like a king, like Aurum, but not Aurum. He has no mineral qualities, and the pathology or the chief complaint is not covered by Aurum. He is highly developed, can take up huge responsibility. They have a strong individual eye, leadership qualities. There is always danger from the outside world. There is always a sudden threat, danger, attack, fear of. Masculine element is strong, so suppression of emotions. He is determined, ambitious, industrious. So sixth club subclass is useful in issues related to power, responsibility, and leadership. This is the Akish chart. Subclass 6 Asteroid Gentianals is here, and we are going to give anal. We are thinking about anal stage of development. By anal stage of development, it is autonomy, starts gaining control over muscles, sphincters, formation of will and doership. He needs to prove, he needs to achieve, he needs to control. Don't want to lose this newfound power. Need to control everything. So we gave him Nux vomica. The rubrics which are covered is jesting, joke, cannot take a, cares, worries, full of business about, loss, financial, aggravate, urination, incomplete, pain, urinate with urging to, pain, standing, aggravate, urination, frequent, night, dribbling by drops, retention with, contradiction, ailments from aggravate, retention of urine, sensation of contraction of sphincter with, urethra narrowing off and urethra narrowing off spasmodic. These are the same rubrics. According to Dr. Rajan Shankaran, the Nux vomica belongs to typhoid myxum Loganiaceae family, must make rapid efforts to recover from the shock very fast. Ailments from shock, from bad news, from death, from losing money. Hard taskmaster. If anything bothers him, he must get it out of the way, go getter by hook or crook. That urine complaints were bothering him, and he was trying to change doctor to help him out. Same is with Nux vomica constipation. Dr. Gandhi says six subclass have overprotective rigid ego. It cannot entertain or contain emotions. Most of the time it defends itself from itself by contracting, spasm or paralysis, connected with retaining and holding or leaving it. Themes of over-retaining. Borek says, first remedy indicated after overdosing, cares and anxieties of business, mental strain and sedentary life, least ailments affect him greatly. Irritable bladder from spasmodic sphincter, frequent cause, little and often. Ineffectual urging, spasmodic, dribbling urine with pain in neck of bladder. Dreams full of bustle and hurry. You can add your desires to be quiet, repose, tranquility. Remedy given was Nux vomica 200 BD for 3 days. when I selected the remedy, this was the main rubric which I considered, because Nux vomica covered 4 marks: urethra, narrowing of, spasmodic. Follow up after 1 month, he was 80% better, so I did not repeat the medicine. In second follow up, he was free of his complaint, so I choose to give sulfur 200 single dose to close the case. What I found is a single remedy rubric in sulfur: urination, inability, urinate, wanted to, but suppressed it when finally wished to, could not pass any. Nux vomica may sometimes follow sulfur and vice versa. They are complementary. So this was the feedback given to me by the patient. He writes here he was suffering from 5 to 6 years. He took many treatment. Urethroplasty was also not successful. So within 20 to 25 days of starting the treatment, he was much better. Along with the urinary complaints, his mental stress was also much better. I suggest you to think about this course because it opens up a wide range of remedies from plant and animal chart. We are very much familiar with mineral chart, but plant and animal chart helps us to decide on the remedy. Also, you can use this PEM knowledge with your repertorial and materia medica knowledge to be sure short of your prescription. And third thing is, there are a lot of correspondence. If you don't get results in plant remedy after giving a plant remedy, you can always think of a correspondence from mineral and animal chart. Thank you.